Today, I want to talk about laser technology and how we use it cosmetically at IAH. There are a lot of lasers out there, and there's a difference in technology between those lasers. But it boils down to two kinds of lasers, ablative and non-ablative. We use non-ablative lasers in our practice for a good reason, and I'm going to tell you why. But first, when you get to the root of lasers, they are all about stimulating collagen production. And which layers of your epidermis you stimulate, that's important. Ablative lasers, such as erbium lasers and CO2 lasers, well, they remove the skin's outer layers, the epidermis, while heating a bit of the dermis below to stimulate collagen production. And ablative treatments can be quite painful. However, this is a very effective way to achieve skin resurfacing. And a month after your treatment, you'll be glowing and happy with your results. Here's the not so great news. After getting through the downtime and some degree of pain, the results aren't long lasting. Why? Well, the epidermis continually makes new skin cells. These new skin cells replace the 40,000 old skin cells that your body sheds every day. It takes about 3 months to go through all the layers of the treated skin before they are all gone. And then you're back in for the next treatment and more downtime. Also, with ablative lasers, there's risks such as scarring, irregular pigmentation, bleeding, and infection. That's why non-ablative, fractional lasers are growing in popularity. These are devices that fractionate the laser across the treatment area. So why is fractionating the laser better than something like a CO2 laser? Well, it's less traumatic to the skin and requires less downtime. But when you get down to it, all ablative lasers are damaging the topmost layers of your skin to make a wound, which encourages the production of collagen. There's usually a week or more of downtime with ablative lasers, and that's a bummer. Also, getting these treatments in the summer can cause further skin damage due to the sensitivity of the damaged outer layers of skin, which can burn. So this is why you'll hear advertisements from medical aesthetic practices. Fall is here, time for your laser treatment, because you don't want to go out in the sun for several weeks after an ablative laser treatment. Now I'll tell you why I don't choose ablative lasers as a treatment for Halo's aesthetic practice. Lasers produce a narrow beam of light, emitted at a specific wavelength, and the length of the pulse matters. A non-ablative laser doesn't cause the wound heal mechanism to produce collagen on the epidermis, because it targets the dermis below for stimulating collagen. And that's where the new skin cells are forming. By delivering shorter, microsecond pulses, we can bypass the epidermis and get deeper into the layers of the dermis. That's where collagen, a protein, makes skin cells strong and resilient. Elastin, another protein found in the dermis, keeps your skin flexible and also helps stretch skin regain its shape. Our laser gets to where your collagen and elastin cells are generated, and because of the shorter pulse, the laser has time to allow the skin to cool between pulses, so the treatment area doesn't become too hot or uncomfortable. The high energy delivered deep into the dermis in short, gentle pulses heats the skin, where it targets melanin and suppresses inflammation while stimulating collagen production without damaging the skin around it. It gets to the root of where things start, underneath the skin that you can see. With this type of laser, you're not going to get the immediate resurfacing effect, but underneath, your skin is going to work on its own ability to resurface and regenerate without creating the wounding on the surface. And so we're starting at the inside, at the cellular level of your skin. And yes, we definitely want to resurface those top layers of your skin. How? Well, we integrate the internal treatment with other external treatments. We can address resurfacing of the top layers of skin in a better and less painful treatment modality, such as a medical peel or microneedling. Microneedling is a great new technology which allows us to incorporate growth factors such as stem cells, PRP, and other products to help your skin regenerate. Halo's integrative approach gives you longer lasting results and treats skin aging issues from the inside to the outside. This is the safest and most effective way to slow down the effects of aging and improve your skin for the long term. If you want to learn more about integrative aesthetics and regenerative medicine, follow us and subscribe to our blog.